Hey health warriors, when it comes to hormones, balance is everything. Too much or too little can throw the entire body into chaos. Today we're comparing Cushing's syndrome and Addison's disease, two adrenal gland disorders on opposite ends of the cortisol spectrum. Let's break it down. Cortisol is a hormone made by the adrenal glands, located on top of each kidney. It helps regulate blood sugar, blood pressure, metabolism, immune response, and your body's stress response. Too much cortisol leads to Cushing's syndrome, while too little results in Addison's disease. Causes of Cushing's syndrome include long-term use of corticosteroids like prednisone, tumors in the pituitary or adrenal glands, and ectopic ACTH production, often from lung tumors. Signs and symptoms include a moon face and buffalo hump, truncal obesity with thin arms and legs, purple striae or stretch marks, hypertension, hyperglycemia, muscle weakness, skin bruising, and emotional instability or depression. Causes of Addison's disease include autoimmune adrenal destruction, infections such as TB and HIV, sudden withdrawal from long-term steroids, and pituitary dysfunction. Signs and symptoms include bronze skin pigmentation, low blood pressure, salt craving, weight loss fatigue, hypoglycemia, nausea, abdominal pain, and electrolyte imbalances with decreased sodium and increased potassium. In severe cases, patients can develop Addisonian crisis, a life-threatening emergency with shock confusion and electrolyte collapse. Diagnostic tests for Cushing's syndrome include Dexamethasone suppression test, fails to suppress cortisol, 24-hour urine cortisol, late-night salivary cortisol, ACTH level to determine if it's ACTH dependent. For Addison's disease include ACTH stimulation test, fails to increase cortisol, serum cortisol, ACTH electrolytes, check for adrenal autoantibodies, CT or MRI to assess adrenal or pituitary gland. Treatment plans for Cushing's syndrome include gradual withdrawal of corticosteroids if iatrogenic, surgery or radiation for tumors, medications to block cortisol production like ketoconazole or mitoprolol. For Addison's disease include lifelong glucocorticoid replacement, such as hydrocortisone or prednisone, mineralocorticoids like fludrocortisone if needed, stress dose steroids during illness or surgery, emergency intramuscular hydrocortisone for Addisonian crisis. Whether it's too much cortisol or not enough, the key is recognizing the signs and restoring balance. Because in endocrine disorders, early intervention changes everything. Have you seen a case of Cushing's or Addison's? Share what tipped you off in the comments. Like, subscribe, and follow for more essential breakdowns of complex medical conditions made clear. And remember, spot the signs, balance the hormones, protect the patient.